Ibuprofen with brand name Motrin and Advil. Is it a blood thinner? If you do a search on the internet, you will get mixed answers. So I'm going to tell you my answer. I agree with the makers of Advil. It's an NSAID, a non-steroidal anti-inflammatory drug, and people who are taking blood thinners would use it with caution. Typically, it is not going to be used with blood thinners. However, there may be certain situations where your healthcare provider suggests it's appropriate to use. In addition, Advil and Mortin and Ibuprofen may need to be discontinued 5 to 7 days prior to surgery. Those patients who need to take these agents preoperatively should use drugs with short half-lives. Now, blood thinners. Typically, when someone says blood thinners, they are referring to either anticoagulants, medications, or antiplatelet medications. Those are used to prevent blood clots. Certain people have health conditions that put them at higher risk of heart attack and stroke. They take these medications to prevent all these conditions. You will sometimes see other people use it for a short period of time following surgery or other issues that may put them at a short-term risk of clots. On the other hand, ibuprofen is an NSAID. It's used to treat inflammation, pain, fever, and arthritis. We do need to be cautious of use of NSAIDs. Make sure we are using the lowest effective dose for the shortest time period possible. Some people with chronic conditions do take these for years without having any issues, but it needs to be monitored by a healthcare provider. Taking NSAID can increase the risk of heart attack and stroke. There is a risk of bleeding in GI tract, in the stomach, in the intestines. Certain people with kidney function problems should generally not take an NSAID unless their healthcare provider determines it's appropriate to use. An NSAID can raise blood pressure. Thank you for watching this short video. I hope you appreciated the information. I would appreciate it if you'd like the video and subscribe to my channel. Thanks again for watching. Do remember, as with all of my videos, this is for informational purposes only, and it's not a substitute for your healthcare provider.